Good day, everyone. My name is Grace Ogala. I bring you good news from Amazing Grace Health Center. The topic of our discussion today is medication management of diabetes. Diabetes is a chronic disease of elevated blood sugar, and someone can be diagnosed of diabetes with an A1C of 6.5 and above. A1C of 5.7 to 6.4 is considered pre-diabetes, okay? Also, a random blood sugar of 200 and above is considered diabetes, all right? But you need to confirm all of that with your doctor though, all right? So for instance, when you just, out of the random, just check your blood sugar, if you find that it's 200 or above, like 250, 300, that's not good at all, okay? And also when you wake up in the morning, something we call fasting blood sugar, you have not eaten 8 hours before the time. If you check your blood sugar and it is 70 to 99, that's fine. But if it's 100 to 125, that's not very good, okay? That's pre-diabetes. And if it's 126 and above, that's considered diabetes. And if this happened on multiple occasions, you need to let your doctor know so your doctor can diagnose you accurately, okay? And also, after the diagnosis of diabetes, the American Diabetic Association recommends a patient-centered approach in choosing the appropriate medication for management of blood glucose in people with type 2 diabetes. And the choice for the right medication is guided by the hypoglycemic risk. Make sure that it's not a medication that will cause low blood sugar. You have to know who you are prescribing this medication for. Also, impact on weight. Most people are big on weight. They don't want to gain weight. You have to check with the patient if they care about their weight or whatever before you start prescribing medication for them. And also, cost of medication is so important because some insurance companies do not pay for certain medication. You have to make sure that person can pay for the medication you are prescribing. And also, risk for side effects. Make sure it's not a medication that has so much side effects. Even the health condition of the patient should be considered as well, and the patient preference should be considered as well. All right. Meal planning is also advised. Before prescription of medication, the doctor will say, "Oh, eat very healthy." It's very important to eat healthy. Half of the plate should be fruits and vegetables. A quarter of the plate should be carbohydrates, not starchy carbohydrate, and the remaining quarter will be lean meats, okay, like roasted chicken, baked turkey, roasted fish, okay, or grilled fish, okay. And also, weight loss of about 7 to 10% is recommended, okay. Exercising about 30 minutes a day is also recommended. Stress management and adequate sleep and dental care, all of these are recommended, okay. And let's go to the classes of medications, okay. The very first class here is metformin. Metformin is very popular out there. It's a diabetic medication and it's usually the first line of treatment for people with diabetes. When I was diagnosed in 2021, this was the first choice of medication that was prescribed for me, okay? We usually start with 500 milligrams twice a day, okay? Then when the doctor see you again, if the blood sugar is not well controlled, the doctor can go up a little bit. All right, doctor know how to adjust this medication for you. And this medication, metformin, it enhances insulin sensitivity, decreases glucose absorption from the intestine, and lowers liver glucose production, okay? It reduces the amount of glucose produced and released into the bloodstream. It decreases insulin resistance by making the skeletal muscles more sensitive to insulin. It can also be used in the management of prediabetes, gestational diabetes, and antipsychotic induced weight gain and polycystic ovary syndrome. The advantage of metformin is efficacy in lowering A1C, being inexpensive. You can even get metformin for less than $12. It's very inexpensive, and it's something you can just save up a few dollars to go and get. It's not in the thousands at all, and that's why I really love this medication so much. It's just that it has a lot of side effects, gastrointestinal side effects. Some patients will tell you that, oh, they have diarrhea, they have acid reflux. I tell you the truth, it can give you a few side effects, okay? And that's why if you start having this side effect, let your doctor know, and your doctor can prescribe the extended release form of metformin for you. And this metformin also help with weight loss, like I mentioned before, okay? I still recall it helped me a lot in losing weight. I lost over 20 pounds with metformin. Right? It was later on that I added the injectables, but I really like metformin a lot. Okay, and when you are prescribed metformin, be very cautious, especially if you are taking birth control pills, because it can stimulate ovulation and increase your risk of unintended pregnancy. So discuss all of that with your doctor, please. And also, having a B12 deficiency is common with people that take metformin. So it would be a great idea to eat food that are rich in B12 when you are prescribed metformin. You can also take B12 supplement if advised by your doctor, all right? And also, metformin, let your doctor know if you are having surgical procedure, okay? Your doctor will make the right decision before he or she prescribe metformin for you. Okay, the second class of medication is sulfonylureas. And the classes of this class of medication, include medications such as glipizide, glimepiride, and glyburide. These are the three common medications in this class. And this medication, they help in lowering of blood glucose through the stimulation of the pancreatic beta cells to release more insulin. It is very affordable, and it does this job. It's just that this class of medication has two major side effects of hypoglycemia and weight gain. So if you are not somebody that wants to gain weight, this medication may not be for you, okay? If you are somebody like me that wants to stay in shape, just tell your doctor, oh, no, I don't want this medication. Again, this medication is good. Like if you are just want to bring down your A1C, maybe if A1C is so high, and you cannot afford the expensive medication, your doctor can prescribe this medication for you and even combine it with metformin. Metformin will help you with the weight loss, and then this one, if it's making you gain weight, it balances itself out. Your doctor is very brilliant, and your doctor knows how to combine the medications, okay? And also, let's go to the next class of medication. They are called the DPP-4 inhibitors. They are great medications for maintaining healthy glucose level. This class of medication slows the inactivation and degradation of the GLP-1. This is a hormone involved in glucose removal, okay, and makes this hormone available for lowering blood glucose, okay? So what this medication does is called an inhibitor, okay? What they do is they will slow the inactivation and degradation because of the GLP-1, because the GLP-1 hormone, you need it in the body because it helps in glucose removal, okay, and it helps in lowering blood glucose. So this DPP-4 will prevent this GLP-1 from being destroyed or degraded. That's a big English. Just know that this is DPP-4 is a good one to prevent the destruction of the GLP-1 that is very helpful to you. This medication do not cause weight gain and improve fasting and after food blood glucose. This very class of medication does not cause low blood glucose because it lowers blood glucose when it is high, okay? An example of these medications are like Tradjenta, Ogala, Januvia. I'm sure you've used this medication or you've heard about it. But these medications could be expensive, okay? And also we have the GLP-1 agonist, okay? This class of medication, you've heard about it. It's just that I'm breaking the big English of it. That's why you don't know what it is. This GLP-1 is an example of it that you all know very well. It's Ozempic. Almost everyone knows Ozempic is very good. It's a good medication. They mimic the action of the hormone called glucagon-like peptide 1. They stimulate the body to produce extra insulin, which helps lower elevated blood glucose after food is eaten. This class of medication also leads to weight loss by curbing hunger and decreasing the movement of food through the stomach and small intestine. As a result, someone gets full quicker and eat less. And research studies have found that there is decreased risk of heart disease, such as heart failure, stroke, and kidney disease when taking this class of medication. People taking this class of medication have seen improvement in their blood pressure and cholesterol level. Okay, great choice of medication. Now you understand why it's so expensive. I love this medication so much. I'm going to be honest with you. It's my favorite. I wish I could tolerate it. Examples of these medications are Bydureon, Byetta, Ozempic that I mentioned before, Rebesios, Victoza, Saxenda. Great choice of medication. I prescribe these medications to my patients all the time, and I love them so much. And the makers of this medication, they are great people, very, very good people, very polite. They even sent me an email sometime. I really love them. I appreciate them for their hard work and all they do to produce medications to manage diabetes. Side effects of this medication are nausea, vomiting, and diarrhea. All right. These side effects can go away after some time, okay? And if you have this kind of side effect, please let your doctor know. Your doctor can prescribe you medication like Zofran for management of nausea, vomiting, okay? And also Pepto-Bismuth is good. And if you have diarrhea, you can take Imodium as well. All right. The constipation associated with it can be managed with laxatives such as Marilas, Ducolas, Coles, Senna. Sometimes we even prescribe Lactulose and even Linces. Okay. So just take this medication religiously, like your doctor prescribed it for you. Okay. And also Saxenda is approved for people that wants to lose weight, okay? So just talk to your doctor and doctor will prescribe this medication if it's right for you. And if you have something like hypertension, heart disease, this is a choice of medication for you, okay? And also Mounjaro is very good. Mounjaro is what I use. Mounjaro is a double-decker medication. That's why I really love it so much. This medication is a combination of the GLP-1 and the GIP. Okay, great medication. I actually heard that it was named after Martin Kilimanjaro in Africa. I don't know if it's true or not, though, but it's a powerful medicine, though. The gastric inhibitory polypeptide and the glucagon-like peptide 1 in Mounjaro are the two primary incretin hormones secreted from the intestine on injection of food or nutrients to stimulate insulin secretion from pancreatic beta cells. Okay, this medication is effective in the management of type 2 diabetes and is administered once a week. Okay, this medication stops the liver from making and releasing too much sugar. It decreases cravings for food, reduces the amount of food eaten, and decreases gastric motility. That's how quickly the food leaves the stomach. Just kind of slow down the gastric process, okay? This medication is effective for weight loss and maintaining a healthy blood glucose level. Based on personal experience and positive reviews from my patients and friends. The common side effects of using this class of medication are gastrointestinal problems such as acid reflux, nausea, vomiting, constipations. The side effects of nausea and vomiting are commonly managed with prescription of Zofran, all right? Like I mentioned as well, it's just the same thing with Ozempic, you know. And if you have constipation, use Ducolas, Linces, Lactulose, you know, Senna, a bunch of laxatives are out there, okay? This is a great medication. It's my favorite all the time. I just love it. But the good news right now is that this company that made Mounjaro, they just released a brand new medication in the market that is strictly for weight loss, and it's called Zepbound. That is Zepbound. That is the latest thing in town. I'm telling you, I know people will look for it, and it's going to sell out very quickly. Okay, just like the company that made Ozempic released Wegovy. So we have the one for weight loss from the company that made Mounjaro. All right, so here are the tips that help you decrease nausea while taking these medications. When you're taking this Mounjaro, this Ozempic, you should eat smaller amounts of food more frequently, about 3 or 4 times daily. Don't eat too much at a time. Stop eating when you are full. Avoid eating fatty food. Eat blunt food such as brown rice, crackers, and toast. Okay, very, very important. And this medication, the GLP-1, GIP, all this class of medication, Ozempic, Mounjaro, you cannot get it if you have a personal or family history of medullary thyroid cancer, or you have a history of pancreatitis. This is not the medication for you, okay? And the next class of medication is the sodium glucose cotransporter inhibitors, all right? This class of medication is my all-time favorite. It helps to maintain healthy glucose level through the inhibition of the GL2 proteins located in the renal tubules of the kidney, which help with reabsorption of glucose back into the bloodstream. Okay, so this very hormone, it's just it's working against you. So what this medication does is that it prevents that reabsorption of glucose back into the bloodstream, okay, which is very good. Can you imagine if all the glucose go back to your bloodstream? It's going to make your blood sugar now elevated. So this very medication, this GLT2, prevents this from happening, okay? Very good medication. Then this leads to the excretion of more glucose into the urine, okay? This medication is effective for lowering A1C, it's very good for weight loss, and it decreases blood pressure. And this medication is also very good for people with kidney disease, heart conditions, and heart failure can benefit from these medications. And examples of this medication is Invokana, Farxiga, Jardiance. Great medication. A common side effect of this medication is increased genital yeast infection. Okay, if you also have risk of UTI, this may not be the right medication for you. Maybe if every time you have a urinary tract infection, you have to discuss with your doctor if this is the right medication or not. Your doctor also know how to prescribe it for you. That all of that side effects will be decreased. So if you love this medication, discuss with your doctor, okay? The next class of medication is the thiazolidine ions. It's a big name. I usually call them TZDs. That's the way I say it. It improves the insulin sensitivity of a person with type 2 diabetes by decreasing the circulating fat concentrations. This class of medication also decreases the production of glucose by the liver and helps insulin to work effectively in the muscles and the fat. Okay, it's a great choice of medication. Very, very good medication. Okay, and this medication is not the best medication for people with heart failure. Okay, it has a side effect of weight gain. Okay, and examples of this medication is Avandia and Atos. But it's a really great medication because it's going to lower blood glucose. But it has the risk of heart failure because it can lead to all these an edema and of lower extremities. But again, like I always say, discuss with your doctor to find out if this is the right medication for you. I know it's not very popular, but it's there, okay? And the next class of medication is biacid sequestrants. This medication is also very good for lowering blood sugar and also lowering the bad cholesterol. This medication is often prescribed for people who are unable to take diabetes medication. So this medication is like a standby. If somebody cannot tolerate the regular diabetes medication, your doctor may consider this class of medication. An example of this medication is Weco, Colestipo. Okay, I know it's not popular out there, but it's available. Okay, and then the next set of medication are the meglitide. These are a class of medication that decreases blood glucose level through the stimulation of endogenous insulin production. Okay, these medications, they are out there even though they are not popular. Example of this medication is Stalis and Prandin. All right, it has side effects of hypoglycemia. It can cause low blood sugar. Okay, and also you have to eat before taking a medication like this. Like if you were doing dry fasting, this is not the medication for you at all. You cannot be taking Atos and doing dry fasting. You have to eat, okay, before and after taking this kind of medication. Do not skip your meals at all. And also, let's talk about insulin. Insulin may be prescribed for people with type 2 diabetes when their blood sugar remains uncontrolled, okay? Like if you keep on taking all this metformin and blood sugar is still very high, your doctor can add on insulin, maybe basal insulin like the Lantus or Levemir at bedtime for you, so that way your blood sugar can be well controlled. Some key points to consider: insulin should be injected into the subcutaneous tissue, not intramuscularly. The recommended insulin injection sites are the abdomen, thigh, buttocks, and upper arm, okay? And also combination therapy of 2 or more medications can also be prescribed to manage the blood glucose effectively. For example, metformin and Ozempic can be combined together, all right, for people with heart disease like hypertension, like I mentioned before. The early introduction should be considered if there's evidence of catabolism like weight loss, or if symptoms of hyperglycemia are present, or when the A1C are very high, or the glucose level is greater than 300, okay? It's just important that the doctor will quickly prescribe this insulin for you, okay? And diabetes pills stop working after a few months or years. This cause is unknown. That doesn't mean your diabetes is worse. When this happens, oral combination therapy can help, okay? Don't get discouraged, okay? When you see your blood sugar is not coming down, when you have done all your best, your doctor will know how to combine 1 or 2 medication or even 3 together, okay? And now we even have some medications that are 3 in 1. So it's getting better every day, okay? And also notify your doctor if you are using over-the-counter medications. Like if you are using something like chromium lowers blood sugar, all right? Let your doctor know about it, so your doctor can adjust the dose of your medication and, keep an eye on you more closely. And also monitor your blood glucose very closely to avoid hypoglycemia, low blood sugar, all right? Like I said, when you wake up in the morning, check your blood sugar. Before you eat, check your blood sugar, okay? Before you drive, if you feel woozy, check your blood sugar. And as advised by your doctor, check your blood sugar, all right? It's just better to be safe than sorry, okay? And before you exercise, don't forget to check your blood sugar. And after you exercise, check your blood sugar. If possible, when you are at the gym, take your glucometer with you. And don't forget what I told you about exercising. Avoid strenuous activities, and don't exercise all at once, like exercising 1 hour at a time. No, break it in bits. You can exercise like 10 minutes at a time instead of exercising 60 minutes at a time, okay? Do everything wisely, all right? And don't forget to always record your blood glucose reading, discuss with your doctor, go to the appointment so your doctor can see what you have and adjust your medications accordingly. And people with type 1 diabetes, they are usually prescribed insulin because they are deficient in insulin due to destruction of the pancreatic beta cell which make insulin. So they often depend on insulin for life. But there is good news in the horizon. There's a lot of research work going on, and by the grace of God, I so much believe that one day that the cure for type 1 diabetes will be discovered. Who knows? And also even the cure for type 2 diabetes may also be discovered. Who knows? And please, that's why I always plead with you all to donate money towards this mission and support American Diabetic Association because they work so hard, tirelessly, day and night. All right. And also, don't forget to see your dietitian to help you to plan your foods very well. And also, sometimes if your blood sugar remain uncontrolled, your doctor can refer you to the endocrinologist. Okay. We've talked a lot this evening. I thank you for listening to me. I pray that Almighty God will heal us spiritually and physically. And I pray that our diabetes will be well managed. And I pray that God will help us, that we'll be able to keep our blood glucose level within 80 to 130 before we eat. And 2 hours after we eat, our blood glucose will be less than 180. Okay? Just do your best. Eat healthy, do the needful, exercise regularly, remain disciplined as a diabetic, avoid eating sweet things if you can. And if you need to eat sweet things, let your doctor know so they can give you insulin coverage for that sweet cake and that sweet ice cream, okay? Just be honest with your doctor so your doctor can help you better, all right? Please follow me on all social media outlets. Until we meet again, it's goodbye for now. God bless you so much.